Hi, folks. My name's Gary Bronze, and I would like to welcome you to this edition of the National Kidney Foundation's Facebook Live video series. Today, we're coming to you on National Gout Awareness Day. So it's no coincidence that our focus today is on the connection between gout and chronic kidney disease. We're going to talk a little bit about the risks of delaying diagnosis for gout, some possible treatment options. And we'll even get into a little bit of COVID-19 and how it impacts the gout and kidney disease population. I'm so glad to be joined today by a couple of experts on the subject. We have with us today Dr. Angelo Gaffo and Armand Halter. Dr. Gaffo is a rheumatologist from the VA hospital in Birmingham, Alabama. And for those who don't know, a rheumatologist is basically a doctor who specializes in the diagnosis and treatment of gout. Armand is a kidney transplant recipient, and he's also someone who's been living with gout for a long time now. He's got a lot of experience with it, as he was telling me earlier, unfortunately. And he's agreed to share his story with us. So thank you so much for joining us today, guys. I really appreciate taking the time.
You're welcome. Thanks for having us.
Of course. Dr. Gaffo, let's get started with you. Before we get too far along here, let me ask you if you could just set the stage for us a little bit. Gout and chronic kidney disease, what is the connection there?
Well, the connections are several, many connections. One important connection is that patients with, you see it from the side of a patient with chronic kidney disease. Patients with chronic kidney disease have a very high frequency of high levels of this chemical substance, which is called uric acid, that many of the people in the audience might know is the chemical precursor to developing gout. And uric acid tends to accumulate in certain individuals, and uric acid forms these crystals, which are called monosodium urate, but these are the crystals that deposit around the joints and around the tissues in the tendons and other tissues. And these crystals irritate the immune system in a way in which later it develops into a gout flare, a gout attack, or they can actually build up in certain areas, in the elbows, in the fingers, in the form of this tophi, and that can sometimes destroy the joints. Now, patients with chronic kidney disease tend to accumulate more of this uric acid than people without chronic kidney disease. And naturally, they have more gout, very high frequency of gout, like 25–30% of patients with chronic kidney disease at any stage will develop gout. If you see it from the other side of the equation, a patient with gout, patients with gout have very high frequencies of chronic kidney disease. It's like 30–40% of patients with gout at certain points in their lives will develop problems with kidneys. And it could be because of a number of issues. This uric acid chemical substance can sometimes is associated with direct harm to the kidneys. The medicines that are used to treat gout, so for example, you think many people take ibuprofen, Aleve, Advil, similar medicines are associated with damage to the kidneys too. So both important connections. Patients with CKD, chronic kidney disease, develop a lot of gout, and patients with gout develop a lot of chronic kidney disease. So many connections.
Sure. No, that's a great explanation. I understand. Armand, you have some experience with this. When did you first experience gout, and maybe, as we were saying earlier, the pain that's so often associated with it?
Well, my first gout attack was when I was 20 years old. I was in college, and I really didn't know what was happening. It was I would describe as a mild pain in the big toe on my right foot. I went to the campus doctor, who properly diagnosed it as gout, but I didn't believe him because I thought that's an old guy disease.
Right.
So, and then it went away. It went away within a day. Okay. And it wasn't until I was in my first job, about a year into it, that I had a gout attack that was, I mean, I was rolling on the couch in the living room. That's how bad it was. It was still in my right toe, but you really couldn't walk on it. Whereas the one when I was 20 was, you know, it was more of a soreness. It was tender, but you know, I definitely couldn't walk on it when I was 23, 22.
Yeah. Did you have any idea that there was a relationship between gout and kidney disease, or
No, I had some operations when I was young on the urethra, really going from my kidney to the bladder. There was some blockages in it, and but that, although the problem was corrected, it left me with backflow from the bladder up to the kidney, which ultimately led to the kidney failure that I experienced. But I didn't associate gout at all with my kidney, and so at the time when it got when I was diagnosed in my early 20s with gout, I went on 300 milligrams of allopurinol, and the problem went away. It just became taking a pill a day. So,
yeah. Did it come back down the road?
When I was 40, I was diagnosed with end-stage renal disease. And within a year, I was on peritoneal dialysis. One of the side benefits of peritoneal dialysis is that it's an excellent remover of uric acid from your bloodstream, from your tissues. I was on peritoneal dialysis for about almost 4 years before my transplant. And looking back on it now, I would say that my tissues were crystal clear, no joke intended. And it was 5 years after my transplant that I had really painful attack in my right wrist. And I did not associate it with the gout because it wasn't what I regarded as a small joint. My wrist was swollen like you really couldn't believe. I went to doctors, but I wasn't going to a rheumatologist. I wasn't going to a podiatrist, and they all thought it was a sports injury. Because at that point I was in my late 40s, around 49. I went to 2 or 3 people. Nobody diagnosed it. One of the troublesome things about gout is that in the early stages, I mean, they'll send you for blood work to confirm it, but if you don't get the blood work right at the time you're having the attack, it may not be in your blood to be detected later on. So there's a no answer. And I was going through that down here. Then I finally called my transplant group up at Hartford Hospital, and they called the doctor on call who was at a cocktail party, and within 2 minutes he diagnosed me as having a gout attack and to get to the hospital.
Yeah. Well, I'll tell you, let me stop you there because I want to ask Dr. Gaffo if you can describe how it's diagnosed, gout that is, and what the risks are, especially for kidneys, if you delay the diagnosis.
Well, so many interesting things to details to unpack on Armand's story. Well, let's start with the diagnosis. Diagnosis is it's usually based on a procedure, and I was talking about those crystals that deposit in the joints and tissues around the joints, and usually the best way to diagnose gout is by aspirating those crystals from a joint. The procedure is called arthrocentesis. You can also call it like a joint tap. It's usually done by a rheumatologist or an experienced internal medicine or orthopedics doctor. So you pull fluid from the joint, or sometimes if a patient happens to have those tophi that are buildups of uric acid, you can stick a needle in there and pull this tissue from the tophi. And you're looking in the microscope, you see those crystals, and that's the best way to diagnose gout. There are other ways to approach the diagnosis. The blood work that Armand was referring to is imperfect. Sometimes it can be low, the number can be low, and it can be falsely low. And if the number is high, sometimes it could be that you have gout, but it could also be that you have high uric acid without gout. That is a scenario that we see in a lot of people. We have more modern techniques. Sometimes you can see it very clear in an X-ray, but not always. You have now ultrasounds, specialized CAT scans that we use. We have many ways to approach the diagnosis, but the best way is through the spinal tap, sorry, not spinal, joint tap. And now, if the diagnosis is delayed, meaning that somebody has multiple attacks and they don't pay attention, they don't care, they don't go to the doctor, or the doctor doesn't have the experience, or it gets dismissed or missed, the problem is damage to the joints. So the uric acid will damage the joints. It can look a lot like having rheumatoid arthritis. You know, it becomes chronic, and joints can get deformed. The kidneys also can suffer. There are good studies now connecting having high uric acid levels with damage to the kidneys. You can imagine also someone taking a lot of ibuprofen, Aleve, Advil regularly because of these attacks, and accumulating kidney damage because of the use of those medications. When gout is properly treated, you don't need to resort to those medicines because you don't have the attacks. So from the point of view of diagnosis, those are the issues that I will identify.
And so with regards to treatment options, you know, I mean, people can self-medicate and feel like they can take NSAIDs, the pain may go away, but they're not doing themselves any favors, or they're not doing their kidneys any favors. Is that right?
That's right. An NSAID, or, you know, again, talking about Aleve, ibuprofen, not all these kinds of medicines, it could make the gout flare go away, but it's going to keep coming back. And at some point, they come back so often that they never essentially go away. And so, because you are not treating the source of the problem. The source of the problem is these uric acid crystals. We have medicines which lower the blood level of uric acid, and they make these crystals dissolve or go away. And that is the final way to control the disease. Like Armand was mentioning, he took allopurinol, and the allopurinol made the gout essentially go away. And that's how we treat most patients. We treat them with allopurinol or some other medicines which lower uric acid. And that's finally the way to control the disease without the need, hopefully, to keep taking ibuprofen, Aleve, Advil, colchicine, or steroid medicine.
Okay, thank you very much. So I want to switch gears a little bit now, a topic that is very, I mean, we're all dealing with it now, and that's the COVID-19 coronavirus. And, you know, I see we're all in our homes for exactly that reason. Is there anything that folks should be aware of when it comes to gout, kidney disease, and the coronavirus? I mean, even just doctor's appointments in general have changed. So I don't know, I guess, Dr. Gaffo, if I can ask you to address that from a medical standpoint, and then maybe, Armand, I'll switch over to you. Maybe you have experience with telemedicine and things like that. But Dr. Gaffo, why don't you start off and just let us know if COVID-19 and gout, kidney disease, if there's any relation there.
Yeah. All right. In the way we manage gout, you know, like many of our in general, not for gout, but for all medical appointments, probably everybody in the audience can have experienced this to some degree. Many of the encounters have been switched to either telephone visits or video visits, and certainly we feel that this could apply well to gout care. There are patients with gout who are having flares and they need to be seen in the office. That's not going to change. But there are many patients with gout who are doing relatively well. who live a long distance away from the rheumatologist, and that probably they need to have their blood work checked. They could have their blood work checked in a local doctor's office or in a freestanding lab close to where they live, and then they could have a telephone or video encounter with their doctors, and avoid probably a long trip to the office, avoid getting themselves exposed to the environment of the office, and probably minimize the risk of getting exposed to coronavirus, COVID-19. So from the point of view of the management, that's okay. Fortunately, most gout medicines do not lower or suppress the immune system. You could think about somebody taking chronic steroids, but that's very undesirable. But other than that, drugs that lower uric acid, like allopurinol, other drugs like colchicine or even NSAIDs, they don't seem to be particularly risky for coronavirus COVID-19. So our patients are not from the point of view of the drugs they take, they do not seem to be at a high risk. Now, many gout patients and chronic kidney disease patients have multiple medical comorbidities: heart failure, diabetes, hypertension, and that certainly puts them at risk for more severe forms of COVID-19. So and they should remain careful, practice social distancing, be very careful of hand washing, avoiding large crowds. So although the medicines themselves don't put them at risk, the usual medical conditions associated with gout and chronic kidney disease can put them in a high risk category, and they need to be particularly careful.
Right. So Armand, you had told me that you had some experience with telemedicine. Is that right?
Yeah, my last visit with my nephrologist was not a video call, was a telephone call. And I mean, it's okay, I know him and like that. But I thought it would be a Zoom meeting. We had tried to set it up, and I guess there was some confusion at the hospital's end and so forth. So it wound up being a telephone call. And so, I mean, personally, I think I'd rather see somebody in person, have the doctor see me, at least look into your eyes and like that. You can see whether you're hiding something or not disclosing everything. I think, you know when your dog is sick, when your baby's not feeling well. It's not they're not communicating by words like that. And that's really all that you get on a telephone, looking somebody in the eye and the face, you can, I can see he's in pain or whatever.
Yeah, no, it's obviously the challenge is for both the clinician and the patient, as you said. And so I'm looking at the clock now and I see, where the conversation's great. What I'd like to do now, if you don't mind, is take a few minutes and see what some of the viewers on Facebook are asking. And so for those of you who are watching, I'll remind you, if you have any questions, you can please just post them in the comments section, and we're going to do our best to answer as many as we can in the time that we have. And just know that if we run out of time, all the questions will be answered on the NKF's Facebook page in the coming days. So let's take a look and see. Here's a question from Nicole Ellis, who is asking if having one kidney puts her at a higher risk for problems if she has high uric acid levels.
That is a very, very smart question, and it's probably a matter of intense controversy right now. As of 2020, there is no indication to treat someone who only has high uric acid levels and no gout, even someone with chronic kidney disease. Now, this is a matter of active research. There are many studies that have looked at, if I give you a drug that lowers uric acid, do I protect your kidney more? Do I prevent progression of chronic kidney disease? Do I prevent further kidney damage? The answer is not clear. It has not proven to be like a home run, like everybody with chronic kidney disease and high uric acid should take medicines to lower uric acid. So at this moment, I understand the concern of the person who sent us that question about having one kidney and having high uric acid. Should I do something about it because I want to protect that kidney? From the point of view of lowering the uric acid, I cannot tell her or him to take a medicine for that. And her nephrologist probably she should of course talk about this with her nephrologist, but I or internal medicine doctor, but I cannot tell her that that would be the case at this moment.
Sure. Okay, thank you. Here's a question from Rita, who is asking, this is interesting, is apple cider vinegar and turmeric, if that can help gout?
Actually, products, high uric acid tends to go up when someone consumes products with a lot of fructose. Apple cider vinegar, not sure how much fructose might be on it. But in general, sugary drinks are not good with people with gout. Now, so I don't think it will help uric acid levels. Turmeric is being proposed as a broad anti-inflammatory for a number of rheumatic conditions. The patients with rheumatoid arthritis, many of them love it. Although studies have not been conclusive about it being beneficial, it seems not to be harmful. I am not aware of any studies in gout. And I will probably not, I will not be sure that it lowers uric acid or causes a huge benefit in gout.
Okay. Let's see. Here's a question for you, Armand. Just in general, Will Torres wants to know how you're doing.
Oh, I'm doing fine. My uric acid levels are, I think they're around 5. They're steady as a rock. I've never had an attack since going back on the allopurinol. So right now it's just a pill. I haven't had any reoccurrence. So
great. Thank you. Here's one for you, Dr. Gaffo. Steve Caliendo is asking if gout attacks not only the joints, but if it can also attack tendons and muscles.
Oh, great question. Yeah, wonderful question. The answer is yes for tendons. For muscles, we know the crystals can deposit in muscles, but what effect would that have is not clear. It doesn't look likely that it affects muscles, but certainly it does tendons. So we see sometimes gout attacks, which are, for example, in the big Achilles tendon in the heel. It gets red, hot, swollen, like we will expect from what Armand was describing in his wrist. So many tendon and tendon insertions can get affected. Sometimes you see the attacks, the dorsum, the top of the hand can get swollen and red and tender, and you cannot move your fingers. It's a gout attack of the tendons of the hand, not the joints, but the tendons. So yes, the answer is yes, it can attack the tendons. It obviously attacks the joints. Unclear what it does when it goes in the muscles.
Okay. Here's another one that came in. No name on this one, but it says, should I be concerned with one kidney and having gout? Am I at a higher risk of problems?
Yes, that person depends a lot on what their a kidney function. Like having one kidney still can translate into a relatively normal kidney function because that single kidney gets hypertrophied and tends to compensate for the kidney that is absent. But that person needs to be more careful about, for example, should avoid taking NSAIDs, Aleve, Advil, ibuprofen, and similar medications because they need to be really careful with that single kidney. And also, probably that person should, I assume probably will have an internal medicine doctor and a nephrologist, make sure that they don't have kidney stones or that anything that will affect the function of that kidney, because having gout and having high uric acid is sometimes associated with kidney stones. So kidney stones in that single kidney can be really very harmful, and so I would say those will be the two things I will be paying attention: use of NSAIDs and other kidney damaging drugs, and the presence of kidney stones.
Okay, this one is from Salman, who says, how many gout attacks can lead to kidney failure?
I'm afraid it's not going to be possible to answer that. Gout attacks per se don't damage the kidney. What damages the kidney in these patients is sometimes having high uric acid levels for prolonged periods. And even that is still under investigation. So one person could have, say, multiple gout attacks, like 20 or 30 in their life, and have a uric acid. You know, a normal uric acid is usually below 6. So that person can have multiple attacks in their life with a uric acid of 7, you know, so high, but not that high, you know, and somebody else can have, you know, like probably can be in their second or third attack and their uric acid is 12, you know, very high. And that person certainly could develop kidney damage relatively earlier. It's a little bit unpredictable. So I cannot say that I could predict it based on the number of flares or attacks that that person has had in their life.
Yeah, it's tough. Obviously, there's a lot of variables involved here, and it's not your patient. You don't know all of the details, but I appreciate the answer. Armand, you have such an interesting story between gout and the kidney disease, and ultimately leading to a transplant. And I'm glad that you're doing well. Do you have any tips for people that are watching on any of this stuff? Could be telemedicine, could be gout, could be kidney disease.
I don't know of anything that gets better on its own. So if something's not normal with you, go and see a doctor, and and the problem is it may not be what you think it is. Like the second, after my transplant, I thought it was something more orthopedic related, okay? And it wasn't. And so that was very frustrating for a number of months. I would have been better off seeing an internist who would take a broader spectrum of that. But fortunately, in my case, I ultimately, you know, called the transplant center, you know, internist of internists up there. So.
Yep. Okay. All right. Looks like we've got time for one more. Let's see here. This one's interesting. Becky is curious to know as to whether or not damaged joints can be repaired. Is it permanent, or is it something that comes back?
That's a good question. When the damage is relatively mild and the damage is relatively early damage, lowering uric acid and controlling gout really, really well can repair those joints for the most part. When the damage is very advanced, meaning there are already deformities, large tophi, that damage is more permanent. So it can get better, but it's unlikely that it's gonna get completely back to normal. But we still treat them well because we want to prevent further damage, and there can be some improvement. But early damage caused by gout certainly can improve largely.
Okay, thank you for that. So it looks like we're just about out of time. I really hope that this was helpful for the people that are watching. I'll remind you again that if you have other questions, or if we didn't get around to answering your question here, you can always check back on the Kidney Foundation's Facebook page. We're going to be posting the answers to all the questions in the coming days. Dr. Gaffo, we might reach out to you for some help with these, and I appreciate your help with that. And you can also always contact the NKF's helpline. We have a toll-free helpline, which is called NKF Cares. And I'll give you the phone number now, folks. That's 855 NKF Cares, CARES. Okay, 855 NKF Cares. You can always call any question that you have about kidney disease, about gout, COVID-19 as it relates to any of this stuff. And at this time, I'd especially like to thank our guests, Dr. Gaffo and Armand Halter. Thanks so much for joining today, guys. Very, very lucky to have both of you here. And now, on behalf of the National Kidney Foundation, I'd like to wish you all good health.
Thank you.
Thank you.